Approach of bone tumor on plain radiograph. We have to look for the age, periosteal reaction, lytic and sclerotic lesion, zone of transition, size and location in the bone, soft tissue involvement, and the epicenter. Age is very much important because certain tumors are found in younger age group and some are found in the older. These are the certain example of the tumor found in younger age group. These are the certain example of different tumor found in different age group. Today we will discuss lytic lesion, sclerotic bone lesion, zone of transition, soft tissue involvement, and the epicenter or the site of the lesion. Lytic or lytic bone lesion, they appear as lucencies, hole, or punched out area due to decrease in the bone density which is seen on an X-ray. In this, the osteoclast activity is superimposed. These are the certain examples. These are the example of the well-defined osteolytic lesion. These are the example of metastasis, lytic metastasis. The lytic bone osteolytic metastasis are distant tumor deposit of a primary bone within bone, which is characterized by a loss of bone with the destruction of the bone matrix. The example, but the lung and the breast both are mixed lytic as well as sclerotic metastatic lesion. These are the certain example of. This is the example of the combination of blast and lytic feature. This is the differential diagnosis of the loose and olytic bone lesion, and the mnemonic is fog machine. This is the example of eosinophilic granuloma. There is a punched out lytic lesion with a sclerotic rim. Is a typical appearance of the eosinophilic granuloma. There are multiple punched out lesions seen in the multiple myeloma. In order to classify whether in the lytic lesion there is aggressiveness or not, there is a classification, Lodwig classification, which is divided into 3 subtypes. But now we are using modified Lodwig-Medwell classification of lytic bone, which also divided in 3 subtypes, type 1, type 2, and type 3. Type 1 has a subtype 1A, which is geographic. The lesion is well defined with a sclerotic rim. Most of the time when there is a sclerotic rim, we consider it benign. Type 1B is a geographic well-defined sharp margin with a non-sclerotic rim. Giant cell tumor is found in the epiphysis with the same appearance in the mature skeleton. And the type 2 is the geographic ill-defined margin, and the margin may be partial or circumferential ill-defined. This is the example of the geographic type 1. This is the example of geographic bone destruction, and this is the 1B. Type 2 geographic ill-defined margin, partial or circumferential example. Type 3. In type 3A, the change of the margin is progressive and there is an endosteal scalloping. Scalloping shows the erosion and indentation in the endosteum. In type 3B, there is a moth-eaten or permeative process. There are multiple holes, multiple lucencies, and there is a periosteal reaction. Periosteal reaction, I have given a detailed lecture in my previous tutorial. And number 3 sees their radiographically apparent features. If we can conclude lytic bone pattern, it may be geographic, permeative, or moth-eaten appearance. Pattern of bone destruction in permeative process, which is also known as aggressive lytic lesion, the Haversian system is destroyed and we cannot appreciate any normal trabecule. Permeative process, there are multiple moth-eaten appear and punched out lesion, periosteal reaction. These are the certain example of the osteolytic lesion. There is a Codman triangle and periosteal reaction. This is the example of the endosteal scalloping, erosion of the inner cortex. Zone of transition. It is the most reliable indicator in determining an osteolytic lesion as benign or malignant. There are 2 types of zone of transition, narrow zone of transition and wide zone of transition. Wide zone of transition lesion cannot be differentiated and show sign of aggressiveness or permeative process. A narrow zone of transition in which lesion can be easily differentiated from normal bone and sign of less aggressiveness. Sclerotic bone lesion, an abnormal increase in bone density within the bone. It may be focal, multifocal, or diffuse. Focal can be found in bone infarct, osteomyelitis, anostosis, osteoblastoma, and osteoid osteoma. And diffuse can be found in osteopetrosis, pycnodystosis, fluorosis, osteodystrophy, and osteoblastic metastasis, which represent sclerotic foci of tumor originating from a distant primary neoplasm, which can be multiple or diffuse. And this is the example of the diffuse osteoblastic metastasis. Soft tissue involvement is also indicative of more aggressive behavior. Sarcoma and osteosarcoma. Site of a lesion or the epicenter in the bone. Site of the lesion can be well differentiated in the longitudinal bone. Location of epicenter of lesion usually determines the origin, whether it is eccentric, medullary, cortical, or interarticular. Centrally located tumor are simple bone cysts and chondroma and fibrous dysplasia. Eccentric tumor can be aneurysmal bone cyst, non-ossifying fibroma, chondromyxoid fibroma, osteoma. Benign versus malignant bone tumor. If we compare both benign versus malignant, the benign has well-defined sclerotic border, while malignant has sunburst or laminated type of periosteal reaction. The benign has lack of soft tissue mass or involvement, while malignant has a soft tissue involvement and it has a permeative pattern. Benign has a narrow zone of transition, while malignant has a wide zone of transition.